Learn how network intelligence protects payer margins during this American Heart Month. February is recognized as American Heart Month, a period that serves as a vital reminder of the immense clinical and financial burden cardiovascular disease places on the healthcare system. For payers and provider network executives, heart disease is not just a public health crisis. It is a primary driver of high-cost claims, utilization volatility, and medical loss ratio instability. Managing these risks require a shift toward proactive network intelligence to ensure that members access high-value cardiac care while plans maintain revenue integrity. Cardiovascular disease remains the leading cause of death in the United States, and the associated costs are staggering. According to the Centers for Disease Control and Prevention, heart disease and stroke cost the healthcare system approximately $216 billion per year in direct medical expenses. For insurance executives, these costs are often concentrated in acute events such as myocardial infarctions and strokes, which result in expensive emergency department visits and inpatient admissions. Beyond acute episodes, the long-term management of chronic heart failure and hypertension represents a significant portion of total medical expense. When a healthcare provider network is not optimized for chronic cardiac management, members often experience avoidable complications that drive up costs. The financial stability of a plan is directly tied to the ability to steer members toward high-performing cardiologists and facilities that prioritize evidence-based interventions and adherence to clinical guidelines. Payers must follow three strategic imperatives for managing cardiac networks. First, payers need to identify unit cost variation in cardiac procedures. Executives must then use healthcare provider network intelligence to perform forensic analysis on the cost of common cardiac interventions, such as stenting and imaging. Significant price variation often exists within the same market for identical services. Benchmarking these rates against objective standards allows payers to identify overpayments and renegotiate contracts that align with market value. Second, payers should verify specialty adequacy and access. Network executives must use data-driven reporting to ensure that cardiology networks are not only adequate in terms of numbers, but also accessible in terms of appointment availability and geographic proximity. Gaps in specialty care access often leads to delayed care, exacerbating clinical severity and increasing downstream costs. Third on our list is that payers need to drive performance through outcomes-based steerage. Managing cardiovascular risk requires steering members toward providers who demonstrate superior results in HEDIS and STAR metrics, particularly regarding blood pressure control and cholesterol management. By using network intelligence to track readmission rates and avoidable complications, payers can identify high-value providers and implement steerage strategies that reward quality while stabilizing the medical loss ratio. National American Heart Month provides a timely opportunity for healthcare executives to evaluate the resilience of their cardiac networks. By applying forensic intelligence and focusing on unit cost stability, payers can transform cardiovascular care from a source of financial risk into a strategically managed opportunity for both better member outcomes and predictable financial performance. Contact TOG today to learn more about how network intelligence services can transform your bottom line.